Let's see if that worked. That's good. That's great. It is kind of brunescent there. Hey guys, it's Dr. Krad, and today I have a really cool video for you. Recently I uploaded a video where I filmed a pre-op appointment with me where a patient and I talked about their cataract surgery. We showed the cataract, we talked about the lens options, and today is his surgery. So if you didn't watch his first video, watch it there. And today we're gonna actually do his surgery. So thanks so much for watching. Let's go.
Hey.
Good morning.
Good morning.
How's it going?
Good, good.
Today we're gonna be doing your right eye cataract removal, right? And we're gonna be implanting the light adjustable lens.
That's right.
Very good. Tell me how you're feeling.
I feel good. Yeah.
Great. Well, it's normal to be a bit nervous, but we're gonna make it easy for you. Okay, we're gonna numb your eye with some eye drops so you don't feel any pain. And we're gonna give you some sedation to be relaxed, not to knock you out completely. We want you to be comfortable and relaxed. But it should take about 10 minutes or so.
Okay. Okay.
No, it should, the whole procedure.
Oh, the whole procedure?
Yeah.
Oh, goodness.
There's more time in the preparation than the actual procedure.
Right.
But the procedure should take about 10 minutes. There are always a risk with surgery. There are always risks. And specifically with eye surgery, the thing people fear most is losing vision.
Right.
There's about a 99.5% chance that everything goes as planned, as expected in surgery today. So nothing unexpected that we see, no complications arise, okay? And about 0.5% of people, we may encounter something unexpected. For example, we might have trouble getting the cataract out or putting your lens implant in, and we have to go to plan B. We might have to put a different lens implant in, for example.
Okay.
But out of that 0.5%, most of the things that happen are treatable. So even people, when we do plan B, usually will see better, okay? There's always a risk of losing vision, but that's really rare.
Right.
That's less than 0.1%. So 99.9% chance today, you're gonna have a procedure that ultimately helps you see better, okay?
Right.
After the surgery, we're gonna give you some UV protection glasses. You're gonna get a pack of glasses, and there's gonna be a dark one and 2 clear ones that protect from UV. So we want you to wear those until we do your final adjustments with the light
Is there a
adjustable
difference
lens.
between the 2 clear? One different shades?
They're not different shades, but one has a reading segment on there to help you read up close.
Okay.
All right. So you'll see them. I'll show them to you. And then today after surgery, you're just going to go home and relax. And then tomorrow we'll check you in the office. Okay.
Okay. Do I sleep at night more on a 45-degree or a flat or on my back? Or?
You know, the most important thing when you sleep is that you're not applying pressure on the eye. So you're not burying or digging your eye in the pillow. There will be a clear shield that you'll wear during sleep for the first week.
Right.
But I'm okay if you sleep in on your back, elevated by a couple pillows or not, as long as you're not applying pressure on the eye, okay, on the eye itself.
Right.
So even you can be on the side, but as long as you're not putting the pressure on the eye itself, I'm okay with that.
All right. Good.
All right. And so we're gonna wheel you back and go. Do you have any questions?
The eye patch at night for 1 week?
The shield at night.
Shield, okay.
So it won't block your vision, but the shield at night as a barrier so you don't rub your eye, that's for the first week.
1 week, okay.
Yeah.
All right.
All right.
Yeah.
Fantastic. I have a question for you. How did you get into teaching Braille?
I started looking into special ed,
Okay.
and then I always thought that losing vision was like the hardest handicap.
Oh, wow.
You know, just
Yeah.
So I looked into working with a blind, and yeah, you have 2 fields. It's working with a white cane, or it's teaching a Braille. I do both actually.
That's really cool.
Yeah.
That's really cool. Is it hard to learn?
It takes, for young kids, they're just following along with everybody else. For like a newly blinded adult, it takes about a year and a half.
Okay, very cool.
Yeah.
That's amazing. You should do an audit of all the Braille in our office, All right.
Now, I did order the Terminator lens, the red one. That
Yeah.
Yeah.
We'll give you a lens that has the red thing, All right, let's go.
All right.
Got
Help
it.
me up.
I'm gonna wheel you back to the room now. Now we are
Wow.
position.
Setup here.
Right? Ain't it pretty cool? Let's see if that works. We got good straight. It is kind of brunescent there.
Am I looking at those three things on the ceiling for?
Yeah, see those three things
yeah.
in front of you? Two are circular, one's like a horizontal strip. You notice that?
Yeah, the one on the like 9 o'clock
Yeah.
is, well, yeah, oval shaped.
Okay, yeah, where you're looking now is perfect. Okay?
Yeah.
If you have pain, let me know. If you have any discomfort, you might feel a little bit of pressure, but no pain, shouldn't be. But we're gonna minimize conversation only because your jawbone here moves your eye.
I got you.
You know what I mean? All right, cool. But if you need to adjust now.
Hold off on Frank Sinatra.
All right, you're good. If you need to move, let me know so that I'm prepared, okay?
Yeah.
All right, cool. Fantastic, just like that. And I'm just gonna test here. Do you feel any pain right there?
Nope.
Nope, okay, fantastic. Very good, just like that. Right? And even though you don't feel anything, we're gonna give you some extra numbing medicine, okay? The numbing medicine does tend to sting a little bit. All right, just like that, stinging a little bit. That's about it. Thank you. You're doing great, my friend. Everything's looking great.
Nice little light show.
Right? Yeah, everyone says it's a nice light show.
Bizarre looking, but.
All right, we are on 80. BSS in the cornea. We're gonna take our time going through the cataract, so thick. You're doing great, my friend. I'm gonna get more visco. If there's in there, I'll use that. Just the visco. The visco here. Oh, yeah, we'll get another one just in case. IA. Very good. Cataract was dense.
And would you like Nicole to open the lens?
Yes, Nicole, you can open the lens. Yep.
Point here, expiration of 2026 for the right.
2026
Doing great, my friend. Doing great. So I'm just polishing everything, so get prepared for the lens.
What are those three lights that I see?
Those three lights are in the microscope.
Oh, cool.
Those are the microscope lights that you see.
Yeah. Good as they're not overly bright.
They can get certainly a lot brighter,
Yeah.
but I try to keep it at a level that's good for you and good for me,
Yeah, that's good. Yeah.
you know?
That is LAL 15.0.
Thank you. There we go. Perfect. Lens implant is in, just kind of sealing everything. Another BSS. So not sealed.
How these three orbs change shapes and colors. It's actually the letter O in Braille.
Oh, interesting. Excel. Moxie. Oop. All right, my friend. Doesn't get looking more perfect than that.
Wow.
All right.
That is great. That is
Very good.
phenomenal.
Awesome, awesome. I'm gonna take off everything here, the eyelid holder,
Okay.
the drape. This is really sticky, so sorry about that.
No worries.
Wet and dry.
I was afraid the drape would have been really suffocating, but it was perfect.
You know, the drape without the oxygen coming to your nose, it would feel more claustrophobic, you know?
The oxygen helps.
But the oxygen helps, yeah, a lot, yeah. Because you need fresh air coming to your nose, you know, and your mouth and all that. Most people don't realize that's there. They're like, oh, I can't take that. They see a video like this, and they're like, I can't take the drape. But they don't realize there's oxygen underneath.
Yeah.
I had one patient tell me that. Like,
Yeah.
oh, you guys put oxygen? I didn't know that.
Yeah.
All right, couple drops, ointment, and then the sun protection, okay? Thank you, guys.
So
All right, so you're like 2 minutes out of surgery.
wonderful, wonderful. It was pain-free, and I was very surprised that it wasn't. Had this thought that it would be really bright. It wasn't. It was
Good.
just 3 little lights, and it was just wonderful.
Awesome.
Yeah.
Very cool, very cool.
And awake during the whole thing and communicated,
Good.
sang 3 songs, right?
Yeah,
Yeah.
that's right, Frank Sinatra. Very cool. So these are one of the pairs of the UV protection. You're gonna get this box, and in this box there are a few things. So you'll have 2 more pairs of glasses, and this is like a clear one,
Right.
and then there's another clear one which has readers built into it,
Ah, beautiful.
okay? And then you also have an extra eye shield. So
Okay.
this eye shield is what when you go to sleep, just
Right.
put a piece of tape over it. So this is gonna go home with you. The minimum wait time for an adjustment in the eye is 17 days. But on average, we wait about 3 weeks.
Okay.
So in about 3 weeks from now, as long as you're healing properly,
Right.
we'll check your prescription and try to do a light adjustment to knock it out.
Okay.
And
In 3 weeks.
yeah, in about 3 weeks, we're gonna knock out your prescription. Now you might get 1 adjustment, you might get 2,
Right.
you can get 3. You can get up to 3 adjustments,
Right.
and then we lock it in place so it lasts for the rest of your life.
And the adjustment is also for the mid-range or just
You can choose.
distance? Okay.
You can choose. So the closer we make it, the more it has a negative effect on your far vision.
Yeah.
So we want to find something that makes you happy.
Right.
If it's near, it's near. If it's intermediate or far, it's those. Most people will give them good far and intermediate.
Yeah.
It has a little bit of depth of focus, but the priority is going to be the far. That's
Right.
going to be the priority.
That's
Okay.
great. Yep. I got to be able to see those 400-yard drives down the
There you go. Now you have no excuse. You have no excuse anymore.
Thank you very much.
My
This
pleasure,
is-
my
this is
friend.
wonderful.
My pleasure.
Thank
My
you.
pleasure, my friend.
You made it a very nice experience, and
My
I
pleasure.
tell you, it's like everybody says, it's really not that much, and it was wonderful.
Awesome.
Yeah.
We will see you in the office tomorrow.
Yep.
Get some good rest
About 4 o'clock.
tonight.
Good.
So tell me.
Well, first off, it was just phenomenal. I mean, I did not feel a thing. You know, you were just a magician there doing all your work. It was wonderful.
We were very fortunate. Everything went smooth. We didn't experience anything that was unexpected.
Yeah.
So when I say 99.5% of people, we don't encounter something unexpected, that's what happened yesterday. So
Yeah.
we got the cataract out, the lens implant in, and you got the light adjustable lens. And so now it's a matter of healing. It looks awesome. Absolutely fantastic. And I'm going to show everyone here what it looks like on the first day out.
Oh, cool.
So there we are. And it was a dense cataract. But look at that cornea. It looks really good. Really good cornea. Let's see any what we call decimate folds. All right, let's zoom in here. There's your lens implant. No more cataract. So that's gone. All right, right there. There we go. All right, cool. That looks great. Let's go back to your other eye. Show that for reference.
So he's saying the new eye is a little bit better than this eye that has a very mild cataract. Very little. This one's the dense one. And this is only the first day out. So overall, you're looking fantastic so far. Okay?
Oh, I feel great.
Good. You can
Feels
sit back.
Wonderful.
So, recap. Don't rub your eye. Use your eye drops. Shield at night when you sleep just to prevent eye rubbing.
Right,
UV protection when you're exposed to sunlight.
right.
For activity, light activity is fine. If you want to go walk 3 miles tomorrow, that's okay. But I don't want you to play sports like if you played pickleball or something like that. I don't want you to do anything strenuous. But light activity, you want to go to a restaurant, you want to drive, that's all okay. I would avoid getting the eye contaminated. For example, showering.
Right.
All right. For the next 2 days, meaning tomorrow and the day after, when you shower, I want you to shower neck down.
Okay.
But of course, you can wipe around your eye. After those 2 days, you can shower normally, but just close your eye,
Okay.
so that the tap water doesn't go directly in there. Just for this first week, I just don't want contaminants to go in
Right.
because tap water is not sterile. It
Right.
can cause infection.
Yeah, I'm not using shampoo, so.
Yeah, true.
I did have one question I wrote down here. It was actually not me, my wife.
Sure.
I think
That's the most important question.
Yes. First one answered. Are the little floaters a concern? She wanted to know.
If the floaters dissipate each day over the next couple of days, I wouldn't worry about it at all.
Yeah.
If they increase, if you start having flashes, loss of peripheral vision,
Right.
that's a bigger concern.
Right.
Um,
No, this is old injury. I know this.
Okay.
Yeah.
and tell your wife you can't work for a whole month.
3 months.
Okay. You gotta get spoiled.
That's great. Well, thanks. No, I think everything was just phenomenal. Like just even the whole setup there with the first crew doing the pre-op,
Yep.
and then the anesthesia is coming in,
Yeah.
and then the nurse, and then you, and then going into that room. That was high tech.
It's
That
a
was
wonderful,
beautiful.
wonderful team. Yeah, it's a beautiful room, beautiful team.
Yeah.
Thank you so much. I'm very happy the way things are
No,
going.
this is great. I love
If you
it.
have any problems, reach out. Otherwise, we'll see you next week.
Yes.
Okay?
We'll see you. Thank
All
you.
right. All right.
Appreciate it.